Welcome to this lecture. I will be introducing you to the trend of digital therapeutics and share a few clinical applications we're developing in our lab that includes digital therapeutic systems for sarcopenians and early-stage osteoarthritis patients. I'm Professor Fuyu Beverly Chen from the Department of Biomedical Engineering of Zhongyuan Christian University. Before we start the lecture, I would like to ask you a question. If I mention treatment, how many possible methods can you think of that a doctor would prescribe to you? I will give you a few seconds to think about it. I guess these are the four main methods you could encounter: drug, surgery, medical implants like artificial kneecaps, and the medical devices such as a heart defibrillator. Have you ever thought that your mobile phone or the app in your phone can also achieve medical treatment? These are not lousy apps. In the US, there are several successful stories. For example, Omada uses the apps to treat obesity, Livongos to treat diabetes, and Propeller combined with device to treat asthma. These are cases with clinical evidence. And lastly is a classic digital therapeutics example. Achilles uses game mechanism to treat children with ADHD. This Evo game has received FDA approval. After looking at some examples, let's clarify different terminology. As shown in this image, digital health is actually a broad term which includes digital medicines and the well-known telemedicines and remote monitoring in the Internet of Medical Things field. And digital therapeutics is a sub-branch of digital medicine. Its definition is evidence-based, software-driven therapeutic interventions to treat, manage, or prevent diseases. From the previous examples, we see that digital therapeutics' main applications are in chronic diseases. And this is due to two reasons. First, it is a huge market in the US, which worth $1.5 trillion. Second, early-stage chronic diseases such as diabetes can improve by promoting treatment compliance and lifestyle and behavioral changes. In reality, behavior change is hard and tedious. For example, in the clinic room, you might decide to cut down on sugar intake after the doctor's reminder. But oftentimes, when you get home and see a delicious cupcake on the table, it is hard to say no to the temptation. In digital therapeutics, manage chronic disease by promoting the treatment compliance and behavior modification. Digital therapeutics is like an app that lives on your phone, but it is more than that. It is a whole program that includes the education materials, a lot of time, remote monitoring devices, software, and coaches' help, which educate and manage about your own condition and treating it. And in that way, it improves the clinical outcome and reduces costs. So why is digital health the next wave of health? Apart from being driven forward by the COVID-19 pandemic, people are starting to realize the health needs are not only in the hospital, but beyond hospital when the patient finishes treatment and is discharged from the hospital and rehab at home, or even way before the patient is ill in the healthy stage. How do we prevent diseases and achieve early diagnosis? Lastly, digital therapeutics mainly use the app on the phone to collect your daily data in order to achieve behavior change and deploy the right intervention at the right time for the right patient. Let's take a look at the digital therapeutic application in sarcopenia and early-stage osteoarthritis.
With the aging of the population, the decline in muscle mass and bone density, and its impact on the life of the elderly are the most severe. Adults over the age of 50 will lose about 1 to 2% of their muscles every year. The physical function and stability of the elderly are reduced due to muscle loss. For example, Patients have poor mobility, such as slow walking speed and possibly unstable gait, poor balance, difficulty getting up from a chair, towels that cannot be drawn dry, the bottle cap cannot be turned off, and subjectively, it is easy to feel tired and begin to show avoidance behaviors to daily activities, leading to a gradual reduction in physical activity, a vicious cycle that leads to eventual mobility and disability. Various physiological changes caused by aging, including musculoskeletal degeneration, endocrine changes such as testosterone, growth hormone, and other changes in concentration and sensitivity changes such as decreased blood flow through muscles and decreased vascular function, nutritional changes such as insufficient protein and calcium intake, decreased activity level. The current clinical standard treatment intervention is to supplement sufficient nutrients such as protein and increase muscle strength to improve and slow down the decline in activity. The existing clinical treatment methods for sarcopenia are not effective because the mobility of the lower limbs is the main cause of disability in elderly with sarcopenia.
In order to reduce the risk of falls in patients with sarcopenia, we propose a digital monitoring system that includes pressure sensors to monitor mobility at home. It provides timely advice on mobility status and intervention advice to reduce the risk of falls. Mobility detection includes balance, gait, and muscle fatigue. Traditionally, IMU sensor is used for gait detection. Foot pressure is used for balance, and EMG sensor is used for muscle fatigue. It is not user-friendly for elderly to wear 3 types of devices on their own, and thus adhesion rate is low. Our mission is to simplify 3 wearable devices down to 1 foot pressure wearable device, which becomes more user-friendly for elderly to wear at home. This system was 8-foot mobile app feedback. It is suitable for sarcopenians to measure mobility at home. When the patient has a decline in mobility, the system will provide intervening notification to minimize the risk of falling, such as a walking cane or a wheelchair assistant is required. The development of this system follows human-centered design, making it user-friendly for elderly to increase the adhesion rate of using these systems. Welcome to DTX Lab. Let's look at the system architecture. We place 6 pressure sensors in the insole. Foot pressure signals are being processed through a low-pass filter and an amplifier. We use the Nordic Bluetooth microcontroller to wirelessly transmit the pressure data to the mobile app for display and data collections. The data being collected can be uploaded to the cloud for storage. The data acquisition is through the analog to digital converter of the microcontroller to sample 6 foot pressure sensors. The value is then transmitted to the app at 1-second intervals via Bluetooth Low Energy. For each transmission, the values of the 6 sensors are packaged into a packet and sent in order. And the mobile phone uses the same order to read the data one by one after receiving it. Then the data is displayed on the app. Finally, the user can store the collected data in the mobile phone and upload it to the cloud server for long-term storage. We use SolidWorks to draw the product's prototype and the appearance of design of the wearable device, and quickly prototype it with a 3D printer. We designed the layout of the printed circuits of the wearable device, miniaturizes to make it more user-friendly. Then, it is the integration of the developed wearable device circuits with pressure sensors, and the Nordic NRF 52840 microcontroller to achieve multi-channel communications of the sensors. Then we use the Nordic development environment to write the firmware for Bluetooth data transmission so that the foot pressure data can be wirelessly transmitted to the mobile phone. The basic functions of the app are written using Android Studio's Kotlin programming language. The functions including collecting data from the device, displaying it, and saving it as a file, and finally uploading it to the cloud server. Mobile phones interface design is an important part of digital therapeutic. A user-friendly interface allows the elderly to use the app for monitoring and checking their own health record without any assistance. This motivates the user to keep using the systems and increase adherence rate. Next, we will show a demonstration of how the system works. First, we need to log into our A-Foot app and connect it with the wearable device via Bluetooth. When they are connected, user is free to move around and the real-time foot pressure data will be displayed on the app. Foot pressure data will be saved to a file automatically, which can then be uploaded to a cloud server. Doctors or family member can access the cloud server to review the data.
According to WHO statistics, more than 250 million people worldwide are affected by degenerative arthritis. In Taiwan, according to statistics from the Ministry of Health and Welfare, about 3.5 million people suffer from degenerative arthritis. The main causes of the disease are aging, joint damage, female group, intense exercise, and long-term pressure. Osteoarthritis is mainly caused by excessive use of cartilage or abnormal secretion of synovial fluid in joints, which affects joint movement and produces symptoms such as pain, swelling, heat, and stiffness. The most common signs are in the knees, hips, and spine. The symptoms of osteoarthritis are progressive. At the beginning, the joints will be stiff and painful, and then become red, swollen, and deformed, unable to stand for a long time. Because of the inconvenience of walking, you will gradually not want to walk, and eventually your muscle strength will deteriorate. If you do not treat it early, eventually you will be unable to walk. The current treatment methods can be treated with drugs in the mid-term, but they cannot be completely cured, and if used for a long time, there will be many side effects. If it enters the severe stage, it can only be treated by knee replacement surgery. The above two treatment methods not only will lead to a decline in the quality of life of the patient, but it will also increase the cost of medical care. However, if the quadriceps is strengthened correctly at the early stage, it can effectively treat degenerative arthritis. The common rehabilitation for early osteoarthritis is leg raising rehabilitation exercise in sitting position. Through this exercise, the quadriceps muscle in front of the thigh can be strengthened. The procedure of the exercise is to sit on the chair and raise your leg to 180 degrees and maintain it for 5 seconds. Rehabilitation movements are simple, but many patients lack the motivation to do it daily due to repeated movements and pain at the early stage.
The seated calf raising rehabilitation exercise is the most common rehabilitation exercise of osteoarthritis. It is easy to do. It requires patients to be in the sitting positions and raises their lower limbs 90 degrees and maintain the position for 5 seconds. Through this exercise, the quadriceps are strengthened so that the knee joint and cartilage are not prone to excessive wear and tear, and the effect of protecting the knee joint is achieved. In this system, we use a flex sensor and an MSP430 microprocessor to transmit data to the mobile app via a Bluetooth module. The mobile app is written using Java language in Android Studio. Next, we will demonstrate the interactive digital therapeutic systems. Before starting the game, users need to connect the wearable device with the app via Bluetooth by pressing the buttons on the top left corner. The user needs to lift their limbs 3 times to calibrate the flex sensor. Once the Bluetooth connections and calibration are done, we can start the game. First, let's look at the design of the system. On the top part, we have the MSP430 microprocessors and Bluetooth. Flex sensors are mounted inside the knee band, and a portable charger is attached on the knee band. By bending their knee, users control the object in the app. When the angle between the patient's thigh and calf is 90 degrees, the object will be located at the bottoms of the screen. In order to avoid obstacles, the users need to raise their limbs to appropriate height. A point is awarded for passing each obstacle. Each limb raising is set at 5 seconds. This exercise achieved the most common rehabilitation movements for osteoarthritis, which we introduced earlier. We can view the historical record as long as we press the history buttons on the main screen, in which we can get our game time and the game score. The users can clearly review their rehabilitation status in this interface.
Hello everyone, I am Chun-Yi Zach Law from the Department of Biomedical Engineering, Chongyuan Christian University. This video will focus on how medical imaging can help with clinical practice and the application of artificial intelligence in medical imaging, especially brain imaging. Traditionally, medical consultation uses
look, listen, ask, and feel the pulse
to diagnose the patient and evaluate the follow-up treatment plan based on it. However, since medical imaging was introduced, it has become prevalent nowadays with the ability to scan the human body in a non-invasive way. The see-through images reveal information about the structure, function, and even composition of the human body. Medical imaging plays an essential role in medicine. For example, when we go to a hospital to see a doctor or have a health check, we might need to use imaging equipment for examination. During the health check, there will be an X-ray examination of the lungs. Through the interaction between the X-rays and human tissues, an image of the chest cavity can be obtained, and the medical staff can check whether there is any abnormality in the lungs. In addition to X-ray images, many images can reveal human body information, such as ultrasound, CT tomography, magnetic resonance imaging, positron emission tomography, and so forth. They all use different imaging principles, and each image has unique physical characteristics to show different information. Below, we will introduce several image processing methods and applications. The first part is the substantial reconstruction of medical images. Today's 3D medical images are mainly displayed in slices and grayscale. It means that medical staff must rely on their knowledge of human anatomy to imagine three-dimensional spatial information in their minds. The interpretation of medical images relies on the experience of medical staff, which poses considerable challenges in training. Through the combination of medical image processing and 3D printing technology, we can use image segmentation to distinguish human tissues. For example, in CT images, we can use the image's intensity information to combine the anatomical position information to mark the tissue structure. Then, with the help of 3D printing technology, human tissues can be reconstructed. After processing the images by software and a 3D stereoscopic model is established, human tissue can be reconstructed to obtain a substantial model. Then, depending on the situation of different individual patients, we reproduce the structure of the human body in this way, which will make it easier for medical staff to train and simulate, and also have the opportunity to let the patients or family members understand the situation better.
The next application to be introduced is the neural reconstruction of the brain. The nerve bundles in the brain are the communication channels for the overall functioning of the brain, or think of them as highways in the brain. These nerve bundles play an important role in transmitting information from the brain and allowing the brain to function properly. In the past, when scientists studied the brain, they could only observe the sulcus or the circuit of the brain. Even if the brain was dissected, they could only get a general understanding of some nerve fiber bundles, but they could not clearly describe the structure of the brain and the areas connected by these bundles. Nowadays, MRI techniques are used to reconstruct the nerve fiber bundles by controlling the physical magnetic field changes and the diffusion of water molecules in the organism to deduce the environment of specific areas. The reconstruction of neural tracts can reveal neurotransmission pathways in the brain, such as those related to vision and motor functions, which can provide more information for clinical or research purposes in the evaluation of brain injury or neuropsychiatric diseases. In particular, patients with brain injury or brain tumor can be directly helped by the ability to show the neurological functions of the brain affected by external forces or tumors, and can be used to assess the prognosis.
Next, we will describe how to generate a diffusion tensor image to map the neural pathways of the brain. First, let us talk about diffusion MRI images. After we review the MRI data, we can observe the images in three directions. The first is the frontal plane, the second is the sagittal plane, and the last is the cross-sectional plane. If you zoom in on the cross-sectional image, you will observe that because diffusion MRI will image different levels of water diffusion, the areas that are whiter in color are the areas with lower water diffusion. And conversely, the areas with higher diffusion will have a higher signal loss. So the darker areas are the ones with higher water diffusion. In addition to the brain, the mouth, nose, and eyes will be photographed during MRI, but signals from outside the brain are not necessary for neural mapping. We can see that the red arrow on the picture is the skull, which has a light gray color. So first, we need to segment the skull so that only the brain is retained in the original image. After separating the skull, a mask will be created on the image. The white area is the brain, and we zoom in on the cross-sectional image to view it. On the left is the original MRI image, and on the right is the newly generated mask. It can be observed that the skull has been removed from the original image. Next, a diffusion tensor model can be constructed after obtaining the MRI signal of the brain. The diffusion tensor model is a 3D model that can be obtained by calculating the tensor in each image voxel using this formula. The 9 data in the array represents the mutual diffusion rates between the x-axis, y-axis, and z-axis in the voxels. And since the upper right 3 values in the formula are the same as the lower left 3 values, the diffusion tensor model can be drawn by obtaining the 6 data in the purple triangle. This is the picture drawn after calculating the tensor model of all voxels in the brain. This picture has 3 colors: red, green, and blue, representing the nerve's direction in the voxel. Red is left to right, green is front to back, and blue is top to bottom. If we zoom in on the image, we can see that the white arrows point in the brain's corpus callosum, where the tensor model is more prominent because the nerve bundles are dense. The red color of the tensor model represents the left to right nerve direction, which is consistent with anatomy and physiology. Finally, we connect the diffusion tensor model to become a nerve bundle image, and we can clearly see the direction of the nerves and their connections. The white arrow is the corpus callosum, and you can see that the area is red and connected from left to right, which is consistent with the diffusion tensor model seen in the previous photo. This is how to map out the neural pathways in the brain. Finally, this video will introduce the application of Alzheimer's-related disease change prediction through the combination of artificial intelligence and medical imaging. Dementia, or Alzheimer's disease, with Alzheimer's disease occupying the most significant proportion of cases, is a long-term chronic disease with a slow onset and cognitive decline. Symptoms include easy forgetfulness, loss of spatial awareness, and in some severe cases, losing the ability to take care of themselves. The world's population is now moving into an aging society, and the dementia population is increasing year after year. Dementia is associated with many chronic illnesses that cause a significant burden on families and society. Through the brain MRI images, we can determine the shrinkage of the brain by the structure of the brain pattern. From a structural perspective, brain atrophy occurs during healthy aging to a mild cognitive impairment and progression to Alzheimer's. However, suppose the subtle changes or patterns of changes in brain tissue between a healthy brain and the onset of the disease are difficult to distinguish with the naked eye. In that case, the combination of image processing methods and artificial intelligence can quantify the changes in the brain and use artificial intelligence to find the characteristics of the changes to predict the cause or state of Alzheimer's disease. One of the apparent features of Alzheimer's disease is the shrinkage of the cerebral cortex and hippocampus, which can be observed by MR images. However, because the shrinkage is not apparent in the early stage, it is not easy to be observed by the naked eye. Therefore, we can use computer computing and artificial intelligence to analyze and predict the shrinkage. We use a program to segment the brain structure and find out the white and gray matter interface and the surface of the meninges in the MRI brain image. By doing so, we can deduce the thickness and curvature of the cortex and then use artificial intelligence to analyze these data. Because segmenting and analyzing the brain is very tedious, we automate these steps by writing scripts to reduce the effort and time spent on each of these steps. Training AI neural networks used to take a lot of time because of the tremendous amount of computation required. However, thanks to the advances in modern information technology and the advent of the GPU, it is now possible to use the GPU to perform a large number of parallel operations, significantly reducing the time it takes to train neural networks and achieving better results because neural networks can be built more complex. Overall, this video introduces the importance of medical imaging in the medical field and proposes several applications through the combination of medical image processing methods and artificial intelligence, which will lead to more mature artificial intelligence computing methods, software and hardware development in the future. As a result, universal and personalized medical applications will become more and more widespread, helping medical personnel with the burden of diagnosis and treatment, more accurate and assisted in prognosis assessment, and more able to implement precision medicine. Thanks for watching.